This session was developed by Vindico Medical Education with educational grant support by Gilead Sciences. More project information can be viewed in the link in the comments. Hi, my name is Tamsy, and discussing HIV prevention is important to me because of the importance of HIV prevention in my community. Hi, Dr. Rolle, can you please introduce yourself?
Hi, Tamsy. Thanks so much for having me and welcome to your viewers. My name is Charlotte Rolle. I'm an adult infectious disease physician and the research director at the Orlando Immunology Center in Orlando, Florida. We are a very large HIV treatment and prevention center and have done tons of PrEP research. And so I love PrEP, Tamsy, and I cannot wait to get into today's discussion with you.
Okay, good. I'm excited. Okay. So I'm in New Orleans. How does someone's chances of getting HIV differ depending on where they live?
You know, Tamsin, you're in New Orleans, right? Louisiana, and I used to live in Georgia. Okay, so I tend to think of those states as being having a lot of similarities, especially when I think about HIV prevalence and incidence, right? You know, Louisiana and Georgia always in the top 10 for new HIV infections in every iteration of the CDC surveillance report that I've ever seen. Okay, and so really, honestly, Tamsi, what that means is that location matters, right? Like, you don't have to be super promiscuous. You don't have to have 10,000 partners, right? You don't have to have a bunch of STDs to come into contact with someone living with HIV in a city like Louisiana or Atlanta, where there are a lot of people living with HIV compared to, I don't know, Minnesota. Okay. I'm just going to pick on Minnesota. I'm not trying to pick on anyone from Minnesota. I'm just using this as an example. Okay, Tamsi. And so what that means from a geographical standpoint is that those traditional factors that we associate in our brain with being, high risk for HIV, they matter less when you're living in an area like Louisiana, New Orleans, where there are a lot of people living with HIV, because your chances of encountering someone living with HIV as a sexual partner are just higher, no matter what kind of behaviors you have. And so
Mm.
that's why geography is so crucial in the HIV discussion, Tamsi. So I love that that's how we started off.
Yes, yes. And for me, I would definitely want to know, like, how does HIV impact women of color?
Well, Tamsi, unfortunately, right, when we talk about women in general, right, they account for about 20% of new HIV infections in the US, annually. Like literally, that's what we've been seeing for the last 5 years. But interestingly, Tamsi, almost, two-thirds to three-quarters of that is in women of color, and specifically we're talking about Black women, right? They continue to have the highest HIV rates of all of the groups of women in North America. And so, as a Black female physician, this was one of the reasons that I was driven into the field, right? Is to sort of see how I could directly impact this or change this by my lived experiences and having those shared lived experiences. But, Black women, Tamsi, there's a lot of power dynamics in our relationships. Our relationships tend to be very complex in this community. And so very often for Black women, their, risk of acquiring HIV is very intimately related to the things that their partners are doing. And unfortunately, it's just the reality that for a lot of Black women, we don't know
Mm.
everything our partners are doing. Like, we often cannot vouch that we're the only sexual partner that they have, right? We don't know if they're dabbling in drugs. Like, we don't know any of these things. And very often, again, because of these dynamics, we don't feel empowered to ask, right?
Mhm.
Because that may be offensive. That may
Mhm.
jeopardize or threaten our relationships. And we don't want to do that. And
Mhm.
so for Black women, it is a very complicated situation oftentimes when we think about the things that drive our HIV risk in our community. And that's why PrEP is so important, Tamsi, because that gives us back the control, right? Like, there are PrEP options that no one has to know that we're on besides us and our healthcare provider, right? And that, includes the partner. It's up to you whether you want to disclose that to your partner or not. And so, PrEP is especially for Black cis women, I really feel so strongly about, and I'm so glad that this is one of the topics that we're touching on today.
Yes, most definitely. So, why is the term HIV risk not used anymore?
So funny. You heard me say that about 10 times, right? In our previous comments. We are really trying to move away from use of the word risk, especially when we're talking about a community setting, right? I don't know if you've seen, Tamsy, there was a really popular HIV prevention campaign. It was launched in DC. The focus was actually Black women. It was a few years ago. And the campaign was called From Risks to Reasons, right? Reasons for HIV prevention. And having one of those reasons be like self-love and self-care and thinking of it as like a wellness tool, right? Because really, Tamsy, like that's what it is. Like PrEP should be a wellness tool for women. Like we care about so many other things, Tamsy. We care about how we look, how much we weigh, like what clothes we got on, this, that, the third. Like we care about so much stuff. Like why shouldn't we put so equal emphasis like on that, right? So reasons for HIV prevention, wellness, sexual intimacy. Sex is fun, Tamsy. It's a lot of fun. Like, like people should feel liberated to have as much sex as they want and explore their sexuality to whatever degree that they want to, right? And PrEP is a tool and an option that allows us to do that safely without the worry and anxiety of getting HIV in the process.
Okay. So I know we've been talking about PrEP. Can you just give me a little bit more information on what is PrEP?
Sure. So PrEP is the use of medicines, and these are medicines, Tamsy, that are in some combination all used to treat HIV, but as standalone options, a couple of them are also HIV prevention options as well, right? So it's the use of medicines to prevent someone who is HIV uninfected from getting HIV, right? And we know that PrEP works both to prevent sexual acquisition of HIV. And then we also have some of our medication options that have data even for drug use, Tamsy. And, people often forget about IV drug use as a route for HIV acquisition. But some of our PrEP options have been studied in that setting and have found to work very well.
Okay, okay. That's good to know. What PrEP options are available today, and how can someone choose between like a daily pill or a long-acting injection?
Yeah, Tamsy. I mean, it really, again, I think about where we've come in the field, and it really, honestly, is an honor to practice today because, we have so many options for our patients. And we know that when we can provide patients with more options that better meet their individualized needs and their lifestyle and preferences, we know that that translates directly into, better clinical outcomes. And in the case of PrEP, better prevention outcomes, right? And so whether you're a daily pill popper and you feel comfortable with incorporating that into your routine, we have daily pills. Whether the thought of taking a daily pill makes you want to gag and you're like, well, Dr. Roll, I don't take any other pill. Like, how am I going to manage to take a daily pill to prevent HIV? Guess what, Tamsy? We have injectable options. You call them long-acting options, injectable options for HIV prevention. We have an every 2 month injectable, and then we also have Tamsy an every 6 month injectable. Think about what that means. A twice a year injectable to prevent HIV, right? And so we really have a potpourri of options available today to really, meet anyone's needs. Hopefully, people can feel empowered to pick the option that best fits with their lifestyle and work with their healthcare provider to obtain access to whatever option they feel may be best for them. And we have some great healthcare providers throughout the country that really know a lot about these options and have the ability to serve a lot of communities, regardless of where you are in North America.
Do racial disparities in PrEP access exist, and what is the potential impact on HIV epidemic?
Yeah, this is a question that kind of keep me up at night sometimes, Tamsy. As a researcher, disparities in access to care are very near and dear to my heart. And we certainly have racial disparities in PrEP that unfortunately mirror the racial disparities we see in HIV in terms of new infections, right? And so our Black and Brown communities, they tend to have the least access to PrEP. They have the lowest rates of PrEP uptake and PrEP use in North America, and that has been persistent ever since the FDA approval of PrEP in 2012. And, we could talk for, honestly, I could talk for 60 minutes on the reasons like why that is, right? Racism, stigma, homophobia, all the things that predominate more so in communities of color, um, uh, inadequate access to healthcare, uninsurance or underinsurance, right? Many of us live in states that did not expand Medicaid, for instance, right? And so a lot of folks from communities of color are left with no real private insurance, or even public insurance, to feel like they can access PrEP. There's so many reasons why that occurs, Tamsy. And the problem with that is that these are the communities that have the highest rates of new HIV infection, and we're not getting PrEP to those people. Right? We have PrEP. It's an amazing tool, but we've seen greater uptake in white communities that also have the lowest rates of new infection. And so I do not expect any of us to be mathematicians and statisticians, but we can imagine a situation in which we don't have PrEP getting to where it needs to go. We actually have the ability to even see more disparities, right? In terms of new HIV infections, if we're not getting PrEP to the communities who need it the most. And that really has the unfortunate ability, Tamsy, to really worsen the gaps when we're
Yeah.
talking about ending the HIV epidemic, if we can't get these interventions to the communities that are most in need.
Okay. So how accessible is PrEP for individuals without insurance and in low income situations?
Yeah, Tomsy, this really depends on where you live. We talked about location matters and geography matters as well, because there are really a couple of ways, and some of these mechanisms are more robust in certain states, right? And so for the most part, the easy answer is whatever is your public health department, okay? Like most public health departments do have some sort of PrEP program for under or uninsured clients, okay? But as you may know, it's kind of hard to navigate a lot of state and local health departments. These are systems that are often very overwhelmed, heavy case burden, a lot of patients, potentially long wait times to get in. So some states have taken it a step further, Tamsy, and there are state PrEP assistance programs. New York is an example of a state that I can give you that has a PrEP assistance program, right? And that operates like kind of sort of in conjunction with the health department, but has a separate funding mechanism. And so through that mechanism, we can get more under or uninsured people on PrEP. The manufacturers of the drugs that we use for PrEP have very robust assistance programs, Tamsy, will often provide the drug completely free of charge to anyone who actually completes the application. And I'm even talking about for the injectables, Tamsy. So don't think that the injectables cannot be provided free of charge for underinsured or uninsured patients. They absolutely can. But then, Tamsy, if someone's under or uninsured and they can get the medication, what about the prescription? What about the
Mhm.
labs? What about the doctor's visits that are still required, right? And so we unfortunately still have that gap for our uninsured or underinsured patients that, for whatever reason, don't want to use the services provided by their local health department. A lot of the community health centers, the federally qualified health centers, they do have PrEP sliding scale programs, right? Based on income. They may charge you a minimal visit for a visit cost. They may have labs that they offer at reduced pricing. We have that here where I work at the Orlando Immunology Center. But Tamsy, it certainly really depends on where you are, whether some sort of program like that may be available to you.
Okay. Well, I really enjoyed this conversation. Thank you, Dr. Rowe, for sharing so much valuable information that's helping educate both me and my community on the importance of HIV prevention.
Awesome. Thanks for having me, Tamsy.
Yes.